Hi everyone, thank you so much for having me here today. My name is Emily Mamo. I've been a registered nurse for over 20 years and have worked in many specialties including respiratory medicine, cardiothoracic surgery and intensive care. Although I really loved my job and the challenges that it brought me every day, as time went on, I felt I needed something different, which is why for the last 6 years I've been managing patient support programs with Sonic Nurse Connect. Earlier this year, I began managing a program called Care for Rare. For those of you who don't know or who haven't heard of us, Care for Rare is here to provide ongoing support for people diagnosed with Pompe disease and their parents and carers at any stage of their journey and regardless of whether or not treatment has been commenced. This is a free, comprehensive and patient-focused program developed by Sanofi Genzyme, who understand how overwhelming a rare disease diagnosis like Pompe can be. So let me tell you a little bit about what support I can offer as the program manager for Care for Rare. First of all, I'm here to answer all kinds of questions about your diagnosis. This is the kind of thing that's going to be particularly valuable to people when they or their loved one is first diagnosed. There's bound to be heaps of questions that you need answers for. Sometimes there's just way too many to remember to ask when you're with your specialist. So I'm here to manage that overflow. I may not have the answer straight away, and there may be occasions where I won't have one at all. But please be assured, if you reach out to me, you will get a response, and I will do what I can to help you find the answers you're looking for. I'm also here to help you navigate your way through the tests and treatments that are such a huge part of having a rare disease like Pompe. Working with you to understand what tests you're likely to need, where to go to have them, what's involved, what the results mean, and working out what to do next is all part of this service. If you are starting enzyme replacement therapy, I can also help you work through the life-saving drugs application process. Living with a rare disease is going to take some adjustments, and there may be some changes that you need to make to things like diet and exercise. I'm here to guide you through these changes by providing information if and when you need it, and by giving you some emotional support and encouragement. I'm also happy just to be here to listen when you need to chat to someone who appreciates how complex your disease is and to acknowledge the physical and emotional impacts you may be experiencing. If you're looking for a little more than I can offer, I'm happy to work with you to find out where to go to get the right kind of support, for example, through services like the NDIS. With the exception of your specialist, many healthcare professionals may not know a great deal about your disease because it is so rare, something I'm sure many of you have already experienced. With this in mind, the last thing I want to offer you is the knowledge that you have somewhere to turn when you need help explaining your disease to a care provider, or if you're seeking some advice from someone who knows your disease process well before making certain treatment decisions. This program, Care for Rare, is here for you and is available to both Australian and New Zealand patients and families. For those of you who would like to reach out, you can contact me via email at enzyme@careforrare.com.au. There's also a toll-free number, 1800 369 963 or 1800-ENZYME. However, this is only available to Australian residents and during business hours. I'd love to get to know you all a little better, so please drop me a line, introduce yourself, tell me a little bit about how you got to where you are with your diagnosis, where you are now, and most importantly, what kind of support I can offer you. The more I get to know you all, the more information I will have about how Pompe disease is impacting you, and ultimately, the more primed Care for Rare will be to help. Thanks.